Welcome. When I watched last year's event, I was surprised to discover there wasn't a one-place study for anywhere in Herefordshire, and this spurred me on to make a more detailed study of somewhere I knew about from my family history. I've set up a basic website, and on there are the details and references for this talk and my contact details if you want to know anything more. In case you don't know, Herefordshire is this county on the Welsh border and just south of Birmingham in the Midlands. And my particular focus is the village of Preston on Wye, which is about 9 miles west of Hereford and not far from the road that connects Hereford with Hay on Wye of Book Festival fame. Initially, I'm focusing on the parish of Preston on Wye, and particularly in the period from 1900 to the start of the Second World War. These are some family photos that I think were taken about in the 1930s in Preston on Wye. Unfortunately, I can't tell you who everybody is, but the bottom right-hand corner is definitely my grandparents' wedding, and I think the lady in the top right-hand corner could be my great-great-grandmother, Elizabeth Townsend. The gentleman with her in the bottom photo, I think, is her husband, George Townsend, and George Townsend certainly features in quite a lot of records. To begin to get an understanding of the people of Preston on Wye, I've looked at 1911 census, and what I quite like to do is print out the schedules index card size so I can sort them and arrange them and kind of make different analyses. Basically everybody in the village was associated with farming, either working on a farm or doing something that served the farm, like the blacksmith, and the population was relatively small. There's about 48 households in 1911. My PhD is in biochemistry, and I've always loved the history of medicine. So my eye was caught early on by an advert in the paper mentioning George Townsend being the secretary for Preston on Wye for the Hereford General Hospital contributory scheme. And looking in a bit more detail, I found some of these larger adverts about the Hereford General Hospital contributory scheme. And then this led me to look at Charles Renton's book on Herefordshire hospitals. This is a brilliant resource if you want to know anything about hospitals in Herefordshire. This told me that the contributory scheme started in around 1926, and it was aimed at working class people who earned less than £260 per year, which is a little bit over £13,000 equivalent nowadays. And it was divided up into districts, which were usually parishes, and there were also employers that led their employees to be part of this scheme. Before the NHS, hospital treatment for most wasn't free, and many hospitals had contributory schemes like this one. For a regular subscription, a scheme member and their dependents could have inpatient and outpatient care at the hospital. This member card gives some ideas of the departments in the hospital and the sorts of treatments you could have. So, for example, something like having tonsils removed in the ear, nose and throat department. It also gives some idea of the cost of the subscription, 3p per week, or a little bit of a discount if you paid the 12 shillings per year. And that was all recorded in this little book to show your contributions. Herefordshire Archive and Records Centre contains the records for the contributory scheme, and as well as things like minutes, they've also got these volumes of the subscribers, and these are arranged by district, which relates to the parishes. I think there's also volumes for employers that had their employees in the scheme, but I haven't looked at these in detail. So I took the volume that contained Preston on Wye and transcribed the 109 subscribers found there. So these subscribers would be the main subscribers, not necessarily listing their dependents, but young people, once they reach the age of 16, may be subscribers in their own rights. So there's a few people here before they got married, perhaps. There are really useful things on here. So you've got transfers if they moved from one district to another noted, and also in the extra column, for example, you've got here my grand's entry. It mentions when she got married, and this when she cancelled in 1938. This was actually a little bit after the time she got married, but it gives you some sort of indication, and might be useful if you're trying to trace somebody between the 1921 census and the 1939 register, for example. The cataloguing of these records is a little bit vague at the moment, and I think there is a plan to improve on that. I'd like to share with you now another story I came across as part of my research of the people of Preston-on-Wye. This is from 1917, so a little bit before the time that we were talking about with the contributory scheme. And it's about a wagoner from Preston-on-Wye who presumably was treated locally by the GP and perhaps the general hospital for some x-rays for a tumour in the skull, and then had been referred to Birmingham, to the general hospital there, in order to have an operation on the tumour. Sadly, it seemed that they weren't able to operate, and he discharged himself from the hospital, returned to Preston-on-Wye, where he committed suicide. And this article covers the inquest into that suicide. The article itself is quite detailed and describes his employer visiting him in Birmingham and learning from a nurse about the x-rays that he'd had. Birmingham was actually a pioneering radiology centre, and Dr. John Hall Edwards had carried out the first x-rays under clinical conditions in 1896. The picture at the bottom shows the apparatus that would have been used in 1903. I assume that by the time we got to 1917, not a lot had changed. However, Dr. John Hall Edwards had lost his left arm as a result of radiation, and therefore had put into place from about 1908 some safety precautions when using x-rays. He died in 1926, probably from a cancer related to the radiology. And if you want to see his left arm, it's available in Birmingham University. I think it's still pickled in a jar. In the bottom right, you can see an x-ray of a skull. That's got a bullet in it from a similar sort of time, to give you an idea of what they would have been looking at and using. And they would have been onto plates rather than onto film at this point that we're talking about. Unfortunately, the operation couldn't be carried out. We don't know exactly what was said and what went on in Birmingham, but he discharged himself, returned home on a train along with a nurse that was also travelling in the same direction, and then made his way back via the carrier from Hereford to Preston-on-Wye. And George Townsend, who's my relative, strangely was the juryman and then got sworn in to give evidence as part of the inquest, because there was enough jurymen apparently. Said that he'd said to him, "I'm bad, I'm done for," and had cried, and he was in a very different position and frame of mind than when he'd left, obviously hopeful of having the operation. And they said he just walked about most of the time. He was depressed, and family had come to visit, and they'd gone out for a walk, and then unfortunately he'd shot himself and been found by one of his children. And so there's the sad end to that tale. It's actually featured in the Hereford Journal as one of 3 stories about shootings at the same time. There was also an accidental shooting, you can see there at Kimbleton near Leominster, and another suicide that's mentioned a little bit later on that took up about half a page of the page 3 of the Hereford Journal on this day. Really, very sad. The previous case wasn't the only suicide in Preston-on-Wye. There was another 20 years later. In this case, a 77-year-old pensioner, John Hughes. Finding this article came as quite a shock, as he's actually George Townsend's brother-in-law, and until I saw this article, I didn't know he'd gone to live with them, or indeed what had happened to him after 1921. We can see from his record on the contributory scheme that he'd been with them since 1932, and I suspect this was the result of no longer being able to work. This case is particularly sad, as we can see he actually ended up dying in the mental hospital, and so this death wasn't rapid. We can't know exactly why this happened, but it raises some thoughts I think are true in rural communities today. Although in both cases mentioned, the men were part of a family and the community, there may be a fear of everyone knowing their business and of the stigma of being mentally ill. By 1937, certainly, mental hospitals had advanced and weren't the asylums of the past. But locally, the GP would have had no specific training in mental health, and locally, there was nothing in between the GP and the mental hospital. Sadly, I think John may have felt a burden. His sister had died the previous year, and his brother-in-law wasn't in good health. He died within the next 3 months. I've put and now because in terms of mental health, I wonder how much has actually changed. And finally, some acknowledgements that you can see there, and a thank you to you for watching.